Iqaluit, it is Friday, December 18th. Today is our last televised update for 2020. We will continue to update our website and with case numbers and provide regular communications and releases if and when needed. Premier social media will also be updated very regularly over the holidays, so make sure to follow that. Premier has a bit of a lengthy year-end update, and Dr. Patterson is going to speak about vaccine safety, and then we will get into questions as usual.
Ula sa kulumi talami December 18, ulumiking ulang pangulang alat tuta banit taksak kaya katam ni Nunavut 2020 mi. Kasi nakakasaya ko tukisigabi mi tukisigabi o katam na to hatsuk palyaning inik. Sibulak tita na to Facebook nga ni tusak so hatta ilata ko chaw hatta lang amiyot. Ako ni galataan na sibulak di ko limalang ayo akago nungwa not amalo luta Patterson ko sa hatta ko kaputi mo tsana.
Ubla tsana no mute. Ublangan yung takwa nuban na hauti hunding ito nutakang ito ublumi ang mamana mo tikidlugo nunawu iluan ni 34 nuban na yung akaktut ang matakwa tamang may akbani sotin ang matakwa maliktaw himayo nuban na yung akang yung mga tatay mga March may pigyak so 5,478 ang 631 huli maliktaw nuban na yung akang yung mga ta Matana na hauti rang miyo takwa 225 Nunavut mute nuwan na yo akalaw tut mamitut nuwan na yo akakunya to ta na TV ko tang na ta na kingun lepang na la matana 2020 mi ukiyo ngani amma manga ublu bigale takwa hanan na ngit ka nga takwa na hauti nuwan na yo akaktut akweni nuit talang itu mandil la kihani takwa nuit tanela mata takwa aitolo ini yu ila aitolo ini mi pilere hokta takwa pilere na mata pilere rasutit nok kangatara kang matatau kihani takwa nunalik ahiani arven ahiani nunalik nuvan na yata ala na patan na nunabum mi okauti yumar mi yabut hakkitaw yumar mi takwa nuvan na yata ala na pat nunaliw ahya amatana kuwehung na ulak tilugo tabad nu kuwehung na kailak man tikilang man kaitiga kawas betana nuwon miu ta takwa kating ngalwa tangin luta amihu tagiluta kating ngangata kuwehung na na igloya hilatani takwa igloya miu tahi matakwa pekatigi hokta he ilagalu hitakwa takwa ngin na utalugin tana nuwan na yuak kawin na huitu matikik kangan ilang iyan na aktu yang isuti nuwan na yuak tahong mata takwa kating ngaluak tangin luta matakwa kaitiga sugit takwa inuit kating nganingin akweni ublaluk tailid lakik tut hunaluk tau kwa kami akweni kangas senang mi matikira rami calling ni ublaluk takatu luit amatakwa nunalik takwa tamang nunavut muted ahingit 15 nguyud luin dihani ayon nangin napat kating ngalwak tangin luta sana nuwan nalwak pijuti gilugo amatakwa kangas senang mi matikira rami takwa inuit Harayawing mi ubalu bakeni community harm kating ngayudluit inui katiluk talo with 25 ubalu batan na inokang niya inokak tuluang nga maliglugo na panga 50% tana na hauti nalia mikin na kaumek pat atok tawlun ni tukihet nang na patana community harm maka ukto kauti gilu 100 inokak tuluang na pat dahil ma 50 ni inokak tuluang kihenin Mano yo 25 na nino kaktulo. Matakwa nuna lukta agwe pingin lugo kating ngayon luitay ka na community hall o arena mi 50 ubalo ba na pa takoya kut ayung ituta na kapini ino kaktulo mga kihanita kwa kaitik ka na waso nunabon miutat taan natay ka ni kalwak lugo takwa kubehong na mi kating nang katigwat yugap ta community harm kating agwat yugap ta naravig yuwa yugap ta kihanita kwa manaw yo takwa pingi kalaw pata piuna kauna ta nuwan na yo jutigilugo tan pingwakti chika kaluwang na patatakwa iswa kayim mga titaka when Dr. Patterson outlay lutit uktok tuloy. Matakwa hanan na watit lugutakwa hunamet piyatit aktua na kang na matataan nuban na yot mikanun kau jiwa kanakta gutakwa adjung ito niya tana ukiyo ngoyo kuwehung na niya kihanata ako na lawalo ni agago imaka agago tay ko inu hibu tokap tinu utang niya amatan tau piwan le yukan tana Dr. Patterson apagina taka tana inu ataw heka pilariga kan latatok tamong nunu ilon itak tulang mangan kuwehuk tu ngatan mo kau tiwak sugi takwa nuntak kalwa nunubun mi tana Santa Claus apagina taka tana Dr. Patterson inutu hubing mingi lo ne ublu 14 tay kaning lo ne kai China tulang mga nunu ilon taka ta nero yoko mata Santa Claus tay ma ublu 14 inutu hubing mingi lo ne hini tawing mingi lo ne kai China tulang ako ma tan na Dr. Patterson angyak na ako mago mata ko nunubun mi uta matnawak pagka adjung itukut ayong naktukut aula kap tatana nuban na yo apijutigilo matnakimat semak tungata ko nunubun mi utanu kowe hutchang nak po kowe hung nakmi ta ko ihumagilugit ta ko nagligiyabut pakanakiyabut ilagiyabut uwaptini mata ko menere chalugit nagligit chalugit abinarapta agago kowe hung nakhiulerop tat te ay langiman matnak mabunga matnak pag ino na bumiyuhit Christmas kowe hung nakatsaluhit. Good morning. Today Nunavut has new cases of COVID-19. Nunavut has a total of 34 cases of COVID-19. The total number of persons followed to date is 5,478. There are 631 persons currently being followed. And this is a number I always like saying. 225 Nunavut mute now have recovered from the virus. This will be our last televised update of the year. Moving forward, all weekend cases numbers for Iqaluit will be reported on Mondays to give our hard-working epidemiologist team a much-needed break. As always, if there's any new cases outside of Iqaluit, we will announce all details right away. We are now fully in the holiday season. I need to remind everyone again to please keep social gatherings small. If you are celebrating with people outside your household, try to stick with the same social circle. Please don't bounce around from one gathering to an entire new group of people. This is how we let COVID get in. A reminder, there are limits to the number of people who may gather inside a home, plus the residents in the household. Iqaluit is to have no visitors. Rankin and Will Cove can have 10 visitors, plus those who live in the home. And all other communities are 15 visitors, plus those who live in the house. This should not be seen as an excuse to hold gatherings or have parties. Please continue to do your part and be cautious. For all Rankin and Will Cove, the number of people allowed in an arena and community center is 25 people or 50% capacity, whichever is smaller. For all communities except Iqaluit, the number of people allowed in an arena and community centers is 50 people or 50% capacity, and again, whichever is smaller. This is not an excuse to hold Christmas games or community events. Unless you have permission and it is deemed safe by Dr. Patterson, do not take chances. As Iqaluit still has active cases, they are still in lockdown and they cannot access these facilities. Your actions this holiday impact everyone around you. I know this will be hard change from previous years, but please continue to practice community care. In other news, I've asked Dr. Patterson to look into making a special someone an exempted critical worker for next week. I'm very, very excited to let all young Nunavut Mule know that Santa Claus has been approved to come into the territory without having to self-isolate for 14 days. That's a good thing. This will allow him to continue making toys with the elves and preparing for a very busy Christmas Eve. So please don't worry, Santa Claus is indeed coming to town in Nunavut this year. Thank you again to all of Nunavut Mute for your patience, compassion, and kindness over the year. It's been a rough one, but one I appreciate for all the lessons I hope you do too. Please stay happy, healthy this Christmas, and please enjoy in safety. Thank you.
Good morning. Today, I am happy to announce that the outbreak in Savikataaq is officially over. This is good news, and both the community and the health staff deserve recognition for getting to this point. With that said, I urge everyone in Savikataaq and across the territory to continue to be diligent about following the public health measures. This will be especially important as we head into the Christmas season when gatherings become more common. After assessing the outbreak situation in Iqaluit and considering that there are still people in isolation in Rankin Inlet and Whale Cove, we have decided that it is not yet time to loosen the public health measures there. Current measures in all communities will remain the same until further notice.
Ulla sakut ullu me huvia sepunga naluna sikun nakamatay na sanikilo amisa makpalya ni ulautuk ani gursimalengan. Taman na to sa kuminaktuk tamakino nuna leinut amalo ana hamnang itulirin mo kinayak ting ilisa kayaw gale tamawa tikiw-tikun na sumamata. Tay makakalawato nga ayaw tukaya kakakikuli mga sanikilo ami nunavuli mga milo suli o Diyos sutsangin naklut yung balik hatalo taan na hamnang itulirin ang mabalik daw galin ni. Taman na pimari luanguan na may huvia subim mulat tilu tata makko katikhatak na alang mimata. Kaya sa law tugus sa mapalani sa mayak veani amalo isa magilo gusulita ko ani teli yo hangas kang sinang mitikirak jo amilo isa malero ta khasma yo gusuli ta ko ana hanang ito rin ang mamalik taw gali khasuyaw ga jang ito. Mano yo malik taw gali no nalililmani suli atane akto khawik kay lawngin itini.
As we move into the holidays, we are eagerly awaiting the first shipment of vaccine to come to Nunavut. It is expected that Canada will approve the Moderna vaccine for use in the coming days, and the federal government has indicated that we should expect to receive doses soon after that. We don't yet know when shipments of vaccine will come or how much of the vaccine these shipments will include. However, we have several rollout scenarios planned, and they will be deployed depending on when and how much vaccine we receive. I would like to take this opportunity to reiterate that the vaccine is safe. It has undergone all necessary trials, has been tested on 30,000 people, and will provide Nunavummiut who take it protection from the virus. Thank you.
Hikam namu palala tiluta tema kayong itsa tu tau takilak hugus vula pami tikiti tau lang ni kaputi Nunavummu. Neriyo naktu kana tamang tau lang na Moderna kaputi ulugalaw ni atuni kavamato hakkulo na lona sisimayo neriyo khujillo tikta ko khilamik ila tikibbiw lang ni tinno khilamik ko. Sulirang ako tikila ila mga takaputi kay mga Iqaluit balo kanu tikita ko ay kisuni ilulihang na mga ta. Kasi ani ta ko at jiging ito ni paknas mayogo hanok kapiyaw katapalya lang ang mga ata ang hangakut ang malukat hanok tigi kaputi ni pisimalirup ta naluna taw lalo ni pivikam ni naluna siya kan na mayong ataan na kaputi at tanang ngimat ta nami suwakti ila kaway saktaw siya sa mayo kaway sakuti malik tugit ta kwalo 30,000 kaway saktaw sa mayo kaputi ta na tanang Iqaluit mga nunavummiunulo sa putiyaw si magutaw ni angat no badyo nang mi. Kuyan na mi.
Kent Driscoll, APTN National News. Dr. Patterson, you just mentioned you have a few rollout plans in mind depending on how and when and the volume of vaccine that arrives. Can you walk us through some of that? What do you expect it to look like?
Kentrosko EPTN kuniluta Patterson tako pangnautaksima nakakata vitako kaputi hangakula mga kanolo tako nalunere kay nakakigin.
It depends a lot on how much we get. We have identified, we know the number of people in each community based on age, so we can target right down to everybody who's 65 and over and offer them all vaccine in each community if needed. Or we could simply go with people who are in long-term care facilities. And if we get a lot of vaccine or get a regular steady supply, we could start right away with offering community clinics where we go move staff and supplies into a community and offer the vaccine to all adults.
Taman naila tako hanutigi pinangnitinni tako pidjutahang angata kisani nonalinni nalunasisimayugu tako khatsini pigia hakayang mga tokiungi maliktugit tako toaga khana angata 65 ne ukiuli yung atanullo nonalilimani atuin na utsotigin yakto taima ukiulinnut tako ningaluin nakuvimmiittunut tako alutiki hattapalle kata kaputi tako atuin na utilaami yavu kikkulimaanu nonalinni kapis hattapalle alakluta.
Dr. Patterson, I asked you this a couple months ago, but things have changed since then. The federal COVID tracking app that you can put on your phone, is there any value to that in Nunavut? Does that work here?
Dr. Patterson, tako maku taki apikilaw simayong anasimalakto tako asudjasimalang mga gavamatakakuni no vadjana mo hakisaw yakko kawisa kutiyo kikkuno vadjana to mga tatamani atutikaka.
I'm skeptical, especially outside of the larger communities. And the reason is there's a lot of places we're discovering where there's a significant portion of people who don't have cell phones at all. And the most recent modeling study that I read estimated that well over half of the people in a group or a community or setting had to have the app installed and running for it to be make a dent in contact tracing. So in Nunavut, putting all those things together, it's highly unlikely it would be helpful.
Tana suliyukit siang itangan piloto minunalipaw yung inaksani mikiyutaw naksani takwa sulolo. Amisi ukalaw takalahang imata ammaluta ko kalimas mayang ikatsiro panlaning inikta ko nalunaytaw si mayusulo aballo ang itamakuni nga tuwin nakakayak tuta ko atu tikatsaro nakulugo kikuni katiyaw si mayuni nalunay ko tawluni. Tay may manunavummitana atu tikatsaro yaksuring itaka.
Jackie McKay, CBC News. Do you know how many doses of the Moderna vaccine you're expecting to get in Nunavut if it's approved this month?
Jackie McKay, CBC kunni hanutigi kaya tako Moderna kaputi ni nunavumwangik taw si malakapin hanutigi nerupin.
It's not certain yet. We're planning for a range and we've put in an ask, but we don't know yet how much we don't know for certain how much we're going to get yet.
Hanutigi lagi uga mga tapi kasi magalwak tigo tutsirak si maluta kasi ana kaya mangitigo hanutigi tiki biula mga ta.
How much was the ask?
Hanutigi apikila kabi.
Between 6,000 and 12,000 in that area, like in that range would be useful for us.
6,000 amalo 12,000 ako ninga nitako na manakay nakayakto si bulak me.
In our wildest guess, we did say if you send us everything we need at once, then we can make it work because we have the storage capacity. But given the numbers that Canada as a whole has, and given that there's plenty of other places that need, that's just not practical or equitable for the rest of the country.
Ilu nang inatang ito niya ulak titsibi gutta kanit sa kayang Iqaluit gutta ko ato ko ta bitsani ato inahatsala kata kasi anitaw kana talimami ta ko sa maktaw na ngata singitaw kapiyaw katta kaya hamna ngata kana talimami sa tema na manangilo kayak to taw tsikilo ato ni katillo pitni rutta.
in some Nunavut communities, such as Harvia, the population is up to 40% under the age of 18. Is that a concern for you for vaccinating the majority of the territory?
Nunavut mitako nunalinni piluattumi avviani sullutako 40% ingitako kyohangatagu 18 tungani tan khano ismalunala khakapiyaw katalakata.
In the long run, we'll have to, when a vaccine is approved for children, we'll have to go back and vaccinate children or offer vaccination to children. In terms of reducing, if not eliminating, the worst impacts of COVID-19, I don't think that's going to be a problem.
What's out? Tamakwati nakulatugalwa sa kusillo tamakwa kapiyaw katakun Kisanita nangutit sigutagun nakatamakwa Novadjuana 19 sang mapalegun nanganita na tohagagilo ang wakatigo.
Dustin Patterson, Atiak News. Following up on Jackie's question, in terms of a later vaccine for children, would that impact the rollout or the decreasing of measures in the territory in terms of safety?
Dustin Patterson at Sakun Nitako Jackie Wapikti Katak Nasusi Hanu Kapiyaw Katala Mangata Taman Nahaya to Niharayak Kapiyaw Katakun Naksipatako Anaham Nangitolerin Mumalita Gali Hasuya Valagun Nasilani.
No, I think if we can get a majority of adults, especially elders, vaccinated and protected from this, then we can look at easing our measures at that point.
Aga, tako amisunak sa innay, piloatimi inuto kay tako kapiyaw sa malakata sa pudjiyaw siya sa mahulugin. Tayo makingunegay sa masaksi ko takakong nalakto ko tako kasuyaw gaya mga ta malitaw gali.
In yesterday's news release, there's a quote from you saying the vaccine is not a cure, but the best defense we have so far. If the vaccine is not a cure, what is the vaccine?
Ipatsada ko pipalayo lang na mo to sa katsa nito saktit sila kabita nakikutaw latakon na kayang makaputi tayo malikisumi taman nakipala ko taw gun nakata nakaputi tayo may kutaw jangipan.
The vaccine doesn't completely eliminate infection and doesn't break transmission. And so putting it that way, that it's to be there as a reminder to people that the vaccine isn't, right now the vaccines we have available don't completely end the pandemic or the problems that we face.
Anay la kaputi kapiyaw katara kalo kay manong utit sila igum na jang ito kalo malos ang mapala ng minukak dit si utaw ngito na kaya kaso ni kisane kay ikamayaw gali tana ato na na laktilo ko tamat tuminga sa mapala yume isuli utaw jang makapiyaw katak sa malakalo kata.
Trevor Wright, Nunavut News. Given the distances between communities, should we expect the delivery of the vaccine to be, I guess, staggered between different communities and stuff, whatnot?
Trevor Wright, Nunavut News Community ko noong sige ito ningin nunali ko awlang titaw katalak kata kaputi nunalino hanuiling alak to kaya.
It depends on the circumstances. If we're doing, or when we start the mass, like community-wide vaccination clinics, that will be roughly 3 or 4 communities at a time, one or probably one in each region at a time. For protecting elders, if we have a limited supply and we're aiming at certain age groups, then it could be in many or even all communities at the same time.
Tako sige katta jangin miyo hanga pigala ningin no tamakko kikuli mga kapiyaw katta palala katta ila kay nunalin nispis pingasuni si tamanilo ni kapiyaw yo ila ataw chiko katta la to nunalin ni abolo ni ataw sarlo ti ato ni avitok si mavio yuni sa ko inu to kay ta sa pumiyaw si mahulugi ta ko nalunang ito si buliw ni ang ata ilunang ni kay ta ko ataw chiko pigyak taw lang ayo.
Again, right now, we've got as many options open as we can, and we will decide based on how much we receive with the first shipment and what the follow-up shipments look like.
Mano yutako nalirarutit sanetu inakaratta tako isumaleruti kalaartugu khanutigi tikibbiugutta malillugitaana sivullerpaami tikibbiugutta tulleanilu khanu tako malittugi khatsini pilaarnivu naluneertauqattalaartu.
With the Moderna vaccine, there's 2 shots. I guess, what's the, how long do you take the second shot after the first shot?
Makoati tako Moderna mo kapiyaw hattara hamneraktaw matatay mga khanutigi akumningani utakkilaurluti kapiyaw kannikattalaqa.
In their research protocol, they aimed at 28 days, and if I remember correctly, it was 25 to 35 days. I'll let Uli.
Go ahead.
Okay. We are also waiting though for the recommendations and guidelines from the National Advisory Committee on immunizations, and then we'll be able to tell people if you miss 28 days, how long you could go before you have to restart. Because sometimes you can, there is some flexibility in how long it can be between the first and the second dose.
Tako malittugi haisarutaussimayo malittaugi eli ullui 28 tungani. Tako kapiyaw hattarayartu tulliani ila 25 olmalu 35 ullui tungani. Tako takikaina hattarayartu tako kanatami tako katimayarala kapuutilirinnermut uqaujissimayo ullui 28 ungataarnu unnekhan. Taima pigiakkanne hattarayarmanga takisani tako akunningani taimaatigi utakkaina hattarayartu.
Kent Driscoll, APTN National News. Dr. Patterson, are there any plans to limit or grant more access to people who have had the vaccine? For example, if you go to get on an airplane, will you be asked, have you had the vaccine? Is there any sort of plan to limit or increase access for people based on them taking it?
Kent Driscoll, APTN kunniluta Patterson tako parnauta mga ta khanu tako khasuyawalla ang mga ta surlo kapiyaw si mga tapiyaw katalaka aulaka suaktilugita kwalo kanutigita tatay mailinganaka.
Not on an individual basis, no. The threshold will be when a high enough percentage of adults across the territory have been immunized, then we will look at altering measures.
Agaw yuman no itako atunirta khatajangit tukisani tako killinga kanutigi percentingi innay kapiyaw si malakata tay may sumaksaksuruti khalagayaktugo.
Arviat's case count is dropping, and at some point, ideally, it's going to hit 0. After it hits 0 in Arviat, how long after that until some of the restrictions get taken away?
Arviani tako khatsin nako palle mata katappalle mata nuwadjuan nakta palle khattaqtu. Tako kanutigi surlo pitakakumni lagi niraktaw patako khasuyawalle ni akateko malittawgi ali tawnani.
It can take up to 28 days for it to get back to what would be the state for the rest of the territory, but it will be gradually moving back to from where they are right now after a little bit of time to where Rankin and Whale Cove are along Nunavut's path, and then a little while after that back at the same level as the rest of the territory.
Tako kay uluni 28 ni kingunagila hangir simalik katamakko tayma chayna nunavumi malittaw galit ito tayma khasuyawalle gayaktut. Filwaktu mitto tako kansinami tikirajuamilu matu palle simalattillugi tamakko nunavu parnautingi malittugi tayma kingunagut tayma chayna veani tayma khasuyawalle gunnarsi gayarmiyo.
Jackie McKay, CBC News. Because you need 2 shots of the vaccine, in the plan for vaccination clinics, I'm assuming you have to go to every community twice. Are you just going to trust people to ensure that they're getting that second dose of the vaccine, or are you going to track the people who get it?
Jackie McKay, CBC kunitako ago makwati kapayaw hattara kalanga takano pang nasimabat makwati nunalino tikititsi kattalakit ubalo tako tuliani kapayaw na mga takano kawyak kaktaw kattanya kakawi saktaw sinarlo kapayaw kanni kalawang mga ta.
We're going to track it and our Chief Information Officer for the Department of Health is working with the team that's planning the vaccination rollout to ensure that that's as accurate as it can be.
Iqawisak palangin na naktavutan na loto sa katsalari ng mga yokari yavuta ko na ni kanayak bingin ni tamak ko nga piliri katikarlo ni tako kapiyaw katapalalik katatay mga kawisak palasin nalakto.
And the number you stated earlier for what you asked, so it was you got the low end of the number 6,000, so that would be 3,000 Nunavut who would get the vaccine then.
Tako perismayati tako 6,000 katsinaw na pangulutik tayo 3,000 ni tako kapiyaw yokali kayaka.
It depends. If we also know that there's going to be another 6,000 or more than that coming 3 weeks or so after that first shipment, and we're confident that we can rely on that, then we can go ahead and distribute all 6,000. So it very much depends on a lot of information.
Tanay la kano kawi manang ito sulo 6,000 ni ungatano lo ni tikit itaw tako sebulak pami tako kapiyaw gayak to tay man natigya malupin sa ako siping asunala tilugi tako 6,000 kanang ni tikit to kakatay may gum na kayak medyo tako katsiw ni malik tugi kaputi tikit hatta palyala ni.
Patterson, that's Yak News. Following the holidays, the South is expecting a spike in cases. Is Nunavut doing anything to anticipate that?
After the holiday, tanan Patterson no na check kung ne kikang na lok tiluga misong palayot sa lang mata sulit amakwa no badjak nakta palayot. Tay maniriw nakha.
We're maintaining our hubs in place. We are by next week we should have entry and exit testing at all of our hubs, and we're hoping those measures will plus the current level of public health orders that we have in place across the territory, that those will protect us from further outbreaks.
Tako ngila khalunani to yung mebiu takiyo kay nakatak to suliata na yaktun. Pinasa ko si ulakto min lupigya ta ulakto tako isak palyayo to yung mebinor amalo awla palyayo kay isak ta katalakto tako na nilo khalunani lo nangin nito yung mebiu yuni. Tako alo kakan nga suliata na yang ataman anahan nang itulakin mo. Balik daw gali asing itamalo sa pumiyaw guti simakunak to taman na Nunavut mo tikik kan na kunag.
So there's a system of measures in place, right from the isolation hubs to the public health orders to the way the hamlets plan Christmas festivities to choices individuals make about keeping their gatherings small, washing their hands frequently and limiting needless trips out. All of those things work together to protect all of us.
Tako ngila jing itu tiyo mata sa pumiyaw gutiyo yu taman na tiki palekan na kunago. Solo tako kalunani anit daily view kay nakto tuyo mivit. Tako alo anahan nang itula na mumbalit daw gali suliatam mata. Tako alo ato ni hamlaw yu pang nasimayang ikuvya subumekano iliyok titsi katalam nang. Tako alo ami sulo alo tikatit daily katak ni agamin niwasay na katak ni tamak ko ilo na tikatit tugo yu vatin nilima sa pumiyaw gutiyo yu.
I know you've discouraged travel to the South repeatedly. Obviously, there are people that are down south now. Following up on Ken's question, although an app may not be useful up here, is it recommended for people that travel down south?
Halunano katang tay la sulia may suta ko alo keno ko sa katak tang tay nakakisaw yak ko hawi sa kutiyo tamani mi halunano kay patatamak ko nga to katakon nakan.
So yeah, first off, we'd recommend against traveling south. For those who need to go south, they should be aware of and at least consider all of the local public health recommendations, and it is their responsibility to follow the public health orders in whatever jurisdictions they're traveling to.
Atuli ko yisi magatela suli aw lakat ako yun at tapi mariyo yun ipidyo takang ito ako tikisa na halunano ka hakto Kaya makuyitsaak tunga sumasaksirut harlutillo taikkoa taunungat upattanginno kanlunaani malittau gaalinditau malin nahattarea kalaamimmata.
Tobiutak CBC kunni takkuat timingittigut saputittaarunnernittuni innai kapiyoqqaaqatau li kapiyoyaraqartuni sivuttuutjooqatau ligaavat takkunangaru kapiyoqqaaqatau yaraaqarpat. Will immunocompromised adults get vaccine priority?
Right now, the current recommendations nationally in Canada are that the main group to prioritize is based on age.
Mana yo takkua malittau gaalinni kanata matule khijausima yo takkua pidjuti khaluanguartuti ukiungitigungaqqaalaartu.
If the te matakot kapiyoyut innai aulaqattarunnarsinnerpat inutuyaraqaangilluti uterunnarsiluti naksatuinnaraaqarluti nuvaktuarnarmit nutaqqalli aannearsaraitui attortaugayarpat nuvaktuarnar 19 mit tikittoqarnerpat kapioqattalunnerutta. If the vaccination started and travel restrictions loosened, what happens if a vaccinated person carries a virus and comes home to a family member that may be a child that has medical problems?
That's a good question. We've been somewhat lucky in Nunavut where we haven't had to deal with those issues as much because of the travel hubs, and so when the time comes to loosen the measures, we'll be looking for something closer to what other jurisdictions have done in terms of isolation and helping Nunavummiut protect their family members who haven't yet been able to get the vaccine. So we'll figure that, we'll have answers for that before we remove the restrictions.
Mitä napikkutitsia vatema Nunavummi tamani akaunaattukkuussimagat tamatuminga kamageaqalaunginnatta taakua utaqqikeina hattariaharninginnu tujommivinni kisaani tamakkoa isumassarsiurutigileriqtigu tamakkoa qasujauvallialaarmangaata taimaatsainnaassinginni kanatami avittorsimaviujuni taakkoa malittaugiali sulitamakkoa ikajorutauniangaata Nunavummi sappummiaussiaarsimaqhullugit kapijaussimalleqqata taimaat kapijauqattaleqqata kiugunnarsilaaqaluartugu tamakkoa qanu piirtauvallianiarmangaata malittaugiali.
Ken Driscoll, APTN National News. Dr. Patterson, you mentioned, both you and the Premier mentioned any community planning, any sort of Christmas event needs to get it cleared from your office. I'm wondering, have you been hearing from those communities, and have any of them had any really good ideas as to how to let people do something over the holidays without gathering against the regulations?
Ken Driscoll, APTN kunni sivulertilu qarsimagatsi tamakkoa huviassubitsiurnaartut angirtaussimagiaharniangaata ilitsinniingaartuni taakkuanuinga nunalinni tusaruminaartuni tusalaqqiqanuupparnarsimammangaata ima katiluatta ililutti qaniiliorutiqaqattarniarmangaata.
Yeah, there's been a number of proposals, and our first thought is, do they meet the guidelines as they are in place? And then people have asked, could you comment on our approach in terms of, in some cases, managing flow of people to minimize exposure, even if they're under the limits. There's been some proposals for running games over the radio, having window decorating contests where the judges will drive around in cars or on snowmobiles to look at the contestants. So there's a wide range of it, and a wide range of proposals, and there's creative people in every community that are figuring out ways to have a different celebration, but still a Christmas celebration.
Jadjigin itune tutsa ila tutsa raktoqarsimayu allabikutigu taakua sivullerpaamin aluna qaaqattaqtavu malitsiaqa yaqalua mangaata taakkuninga malittaugialinni uqausitsaharbi uqatta ila uqausitsaaqattaqunnaarsungalu taakua qanu aulatsigunnar iserpalliajuni anivalliajunnilluuni ima katiluatailit taakua alu ilangi tutsirautiussimayu suurlu naalautikku pinguartitsiqattanermi Balu igalaangin takuminartunik sak piliutititaulutik huviasubissiutinik taima saalaqqarasuaqattarlutik tamakkuninga atsigingituni tusarsimajugu tamakko sanatuyualuussimayu ilangin qanu iluurumammangaami huviasubbinni.
President Patterson, Nunavut News. I was just wondering if you had any updates on the hub review.
Dastan Patterson saakunni taakko khiviq ila khimiqquyausimatillugita yurmivi qallunaani qanu ilis ila ullumimu qanuippa.
Nothing yet, sorry.
Sulipitakangi.
I was wondering if you had an update on the rapid testing in the Winnipeg hub.
In where? Winnipeg?
The Winnipeg hub.
Takwalo kano khawiyisaqtauqattartu tusarsimabi Winnipeg mi qilamiuyukku khawiyisaqti.
Yeah, it's continuing. It's still voluntary. I don't know of another positive case at this point. And the testing in Ottawa and Edmonton will start probably Monday.
Ottawa and
Edmonton.
Sulitaman na kayo sa iyo kasi nangiksimayu taakua khawiyisaqtauqattarunnartu naliraaruteharunnartu khawiyilawngittungalu suli nalunaertauyoqarkannilaw mga nuvadjuarnartulummi kisani tamakkua pigialaalirtu Ottawaami Edmonton milu tuyurmivingin.
And will the Ottawa and Edmonton testing be voluntary as well?
Taakua Ottawaami Edmonton milu angiksimayu kisani tau khawiyisaqtauqattalarmiyu.
Yes.
Jackie McKay, CBC News. We have a question coming from Facebook. They want to know if the vaccine is safe for those with pre-existing conditions such as pneumonia.
Dan Jackie McKay, CBC kunni Facebook kugua periyuhanga taakua khanu igutilin taana kaputi attanarayangi kula mga surlo ipinaaqattartunu.
As far as we know right now, yes. There's not been any significant flags on pre-existing lung conditions that I've seen, and we should know in the next week or so what the national standards are for this vaccine.
Khawi mayugu taana khawi mayabu malittugi ismaalum nartoharsimangittu surlu puvamigu hanu igutili taima ela attunerlu tauga yammangata kisani pinasaarussiulaartumi khawigunarsilaartugu kanatami malittaugialinni tamatumunga.
And can you say how many days since the last case recovered in Savikataaq?
Hatsiusimalekha ullui taaka khanuigumniirtu khalaussimatilluguni taabani sanikiluanni.
Yesterday was 28 days.
Ippatsha 28 ullui anigursimalilaortu.